Hi, I'm Phil Yazbak with the Neuroscience Group, and I've been asked to talk to you about pain control at home following your surgery. We use different regimens for pain control, but typically after a neck or low back surgery, most people will be on a narcotic. The narcotic medications that are typically prescribed include an active ingredient such as hydrocodone or oxycodone combined with APAP, commonly known as acetaminophen. And typically these medications are taken as 1 or 2 pills every 6 hours as needed. These are strong pain relievers, but they also have side effects to include fatigue and constipation. So along those lines, typically patients want to be taking a stool softener, such as Colace or Miralax, and having a generous amount of fruit and fiber in their diet and avoiding things that bind like cheese. If you've had a fusion, we're reluctant to have you take anti-inflammatories after surgery, drugs such as Advil or Aleve, because those drugs actually will retard the fusion process. In the scenario in which you've not had a fusion, Advil or Aleve can be excellent pain relievers. The Advil is taken as 4 pills or 800 milligrams up to 3 times a day with food, and the Aleve is taken as 2 pills up to twice a day with food. If the anti-inflammatories provide you with reasonable relief, then your consumption of narcotics will go down, and that will generally be a good thing in terms of side effects. Activity is a reasonable consideration as well. We want you to be reasonably active after surgery. This is typically not a problem for patients who've had a cervical or neck surgery. With or without a collar, those folks are pretty mobile. The low back pain patients obviously have more discomfort, especially when you're talking about going from sitting to standing. So it's always nice to have a grab bar or object available to you as you go from sitting to standing. And I would also state that if you're taking a reasonable amount of narcotics with or without anti-inflammatories, and it seems as though your walks might be causing you more pain than comfort, you might be overdoing it. Obviously, we want you to work on getting more and more mobile over time. Other things that can help at home are certainly ice. For our low back patients, they'll typically be sent home with what's called a cryo cuff. This is essentially a cooler that circulates ice water by your back. We don't have a similar device for the neck, but many people will use actually a bag of frozen peas. They can take them out of the freezer, break them up so that the bag is more flexible, and then that can conform nicely to either the front of the neck or the back of the neck as needed. Our hope would be that your pain decreases over time the farther out you get from surgery. A sudden increase in pain would be a reasonable excuse to give our triage or nursing folks a call to discuss the situation. Thank you very much.